Hello, I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. I'm a board-certified chiropractic physician. That means I am the expert on how to live a pain-free life. Do you suffer from peripheral neuropathy, chronic pain in your hands or feet, where your hands and feet or legs are on fire, they wiggle at night, they're restless, they never stay still? Does it ruin your night's sleep? Does it change how you feel in the morning as a person? The answers to those problems may very well be found in this book, and I'm here to tell you a little bit about it today. How does our office treat these conditions? How do we change people's lives permanently to a healthy, pain-free lifestyle? I'm Dr. Jeff Smith, the author of this book. That means I'm the expert on peripheral neuropathy, restless leg syndrome, and all those conditions that are currently ruining your life. Let's learn a little bit about how our office treats these conditions. Let's get started. Alright, let's get started talking about how we can change your life. We treat patients in this office like family. We consider them part of our extended family. Now, your doctor may give you medications, shots, pills, recommend surgeries. We're not going to do that here. Those things only treat your symptoms. They don't treat what's the problem. They don't treat the actual core issue. If you have migraines, headaches, bulging discs, metabolic disorders, fibromyalgia, those are all symptoms of a greater issue, a greater problem. And I guarantee you your doctor hasn't addressed those issues in your life, or those pills you would have taken would have got rid of the problem. How do we take care of these things in our office? I'm here to tell you the answers are found in neurological and metabolic treatments. Now, what does that mean? Neurologically, brain, central nervous system, spine, your spinal cord, how your brain communicates with your body. If I wiggle my left hand, it's the right side of my brain that says to do that. If I wiggle my right hand, the other side says to do that. Metabolically, blood, hormones, calciums, sodiums, potassiums, white blood cells, red triglycerides, all those things play a role. If your doctor doesn't touch on all those subjects, you're never going to get well. Part of that is found in the book I wrote, Living Pain-Free, It's Your Choice. When our patients come in, we'll also send them a DVD, little video you can watch at home, much like the one you're watching right now. How do you treat those conditions? Well, you got to test for them. If you don't run the proper tests, you're not going to know what to do. Now, some of you may say, well, my doctor already ordered some tests. He ordered blood work. Guarantee you he didn't order what you needed. Are you allergic to soy? Are you allergic to wheat? Do you know what gluten is? Do you have sensitivities? Guarantee you haven't had those tests run. And if you have them, you're going to have a firestorm of problems, but no answers. We have the answer. How do you finally end your chronic health condition nightmare? How do you do it? What makes us different? In our office, we treat metabolically and neurologically. What that means essentially is that we leave no stone unturned. We're going to determine the exact cause of your condition, why you have it, what you can do to fix it, and how to keep it gone. We do so by ordering specific metabolic tests based on specific panels. Okay? A thyroid panel, a complete metabolic panel, a lipid panel, a complete blood chemistry with differential, which means it's got to break down all the little parts of there so we know what parts are good, what parts aren't good. We can assess your thyroid, your adrenal glands, your livers, your kidneys, your white blood cells, and your gut function. All of those things can be affected by chronic health conditions. And if you're not addressing those issues, no matter what your condition is, you're never going to get any better. Okay? The thyroid, for instance, controls darn near everything in your body. Okay? Your TS3, your TS4 values, the doctor has to know what those values are. Are they in the normal range or are they in the functional range? Okay? The normal range for a blood test may be 0 to 20, but the functional or the optimal range may be from 10 to 12. I need to know where you fall. Specific tests are going to show that. Sensitivity testing. How do you know if you're sensitive to certain things? Are you allergic to gluten, which is found in wheat products? Okay? Rye, oats, and barley. Do you have any allergies to milk, eggs, yeast, or soy? If you're sensitive to any of those things, it could be making your condition worse and literally increasing inflammation in your brain. You can't have that. We can't have inflammation in your brain. It'll kill you. Okay? If you have a chronic health condition and you're having inflammation in your brain because of what you're putting in your mouth, you better darn well have someone tell you not to do it. But if the doctor doesn't run the tests, you're never going to know that information. How do we determine that? Well, let's talk about that a little bit. Here are some of the symptoms that you might suffer. Sensitivities. If you have sensitivities to those things I just mentioned, you might have chronic pain or fatigue. You might have frequent indigestion, heartburn. You might be bloated after you eat. You could have frequent loose bowel movements. You could have constipation, ulcers in your mouth. I've seen it. I have patients that have ulcers in their mouth. You may vomit often, and you may have no idea why you're doing it. And it might not pertain to your migraine condition or your peripheral neuropathy condition, but it's a big part of it. Okay? We run a test called an adrenal stress index. That test is very important because your adrenal glands are responsible right here for your stress, how you deal with stress, and your blood pressure. If your adrenal glands aren't functioning, there's no way you're going to be healthy. Okay? It's going to allow cortisol levels in your brain to go through the roof. Those cortisol levels are going to keep you up all night. They're going to eat away at your brain tissue. Autoimmune conditions. What's an autoimmune condition? Autoimmune is when your body literally attacks itself. Okay? If you're an autoimmune patient, if you suffer from certain conditions, let's say rheumatoid arthritis, your hands may be red. You may develop swelling in the knuckles and they get hot and your body's literally eating away at itself. That's an autoimmune condition. That condition means that your body is killing itself. Okay? How do you know if you have an autoimmune condition? Well, you run the test. You run the test. Thyroid. If your thyroid is autoimmune and your body's eating away at your thyroid, okay, what's that going to cause? Well, fatigue. It's going to add to pain, and it's going to cause weight loss and severe hormone problems. Okay? How do you know if you have it? You got to test for it. For example, many chronic pain and chronic fatigue patients we've treated have tested positive for thyroid antibodies. What that means is they're actually misdiagnosed. Your doctor misdiagnosed you. Okay? If your thyroid tissue antibodies, TPO and TPG, are high, you're suffering from what's called Hashimoto's disease. Okay? You can Google it if you want to know what Hashimoto's disease is. Okay? The only way to find out is to test the thyroid tissue for antibodies. Your immune system literally could be attacking your brain and your central nervous system, and the only way to know is to run the test. But the doctor has to know what test to run. They've got to be trained in this type of thing. For example, if you suffer from antibodies tissues, okay, further blood work is needed to determine which part of your immune system is functioning, which part is. Okay? Lymphocyte subpopulation, Th1, Th2 cytokine panels, natural killer cell activity. All those things have to be tested. We have to know what's going on inside your body to affect and treat what's wrong with your condition. Helicobacter pylori, H. pylori, popular a few years ago because it was determined that that was the one thing that caused heartburn. It's a bacteria that's in your gut, and when that bacteria overgrows and overpopulates, you get heartburn, you get gastric problems. You ever felt really bloated after you've eaten a meal? Your H. pylori levels are through the roof because all that bacteria is attacking that food and producing gas. That's why you're blowing up. That's why you can't get comfortable after a meal. Okay? A test, a simple blood test, answers that question.